Welcome, everyone. We're so glad you're here. Today's session lays the essential groundwork for the journey we've begun through the Causal Pathways Initiative. And so, this initiative exists to make visible what often feels like a black box in philanthropy and systems change work, to help us collectively see how systems are not changing. So we're part of an international learning community of evaluators, strategists, funders, and change makers who are all grappling with one core challenge. How do we understand what's actually contributing to change in very complex dynamic systems? So this module is all about building shared understanding of what causal pathways are, why they matter, and what it takes to be truly ready to explore them. And in many ways, today is our pause just before a deeper dive. It's where we begin to challenge assumptions, surface myths, and think more critically about how change really unfolds, not just in theory, but in practice. So what we explore today will set the stage for the design and implementation strategies we'll unpack in Module 2, and the rigor and values we'll put into motion in Module 3. So let's begin by grounding ourselves in both the mindset and the muscles we'll need to make the most of this approach. So I'm Kimberlyn Butler, founder and chief possibility catalyst of the LEAD Agency, which is a social impact firm that partners with foundations and philanthropic organizations to design equity-centered strategies, evaluations, and learning experiences. Our work is rooted in systems thinking, participatory methods, and a deep belief in the power of community voice to drive lasting change. I really love this work because I get to bring my lived experience growing up in the US South, but also having been a teacher and also working in different systems to bear in this work. So I've been managing the Causal Pathways Initiative as the philanthropic engagement lead in the past, in a role I first really stepped into during our first global symposium. Since then, I've had the pleasure of listening, I've had the pleasure of facilitating and helping build understanding in conversations like this one we're having today. And it's been honestly quite incredible to watch this movement grow from a concept to truly an amazing, impactful movement, which is why you're here. I've also had the opportunity to actually apply causal pathways evaluation directly with foundations that are ready to move beyond traditional models, to kind of better understand how change really happens in complex systems and how to learn in partnership with those doing the work on the ground. And I'm especially excited to be joined by my colleague and co-conspirator in this work, Hippolyte Pohl, who brings deep expertise in program design, evaluation, research, and learning. And so now I'll turn it over to him to introduce himself.
Thank you so much, Kimberlyn. Kimberlyn has mentioned, my name is Hippolyte Pohl. I live and work out of Ghana in Africa. Over the last 35 years or more, I've worked in international humanitarian development field, overseeing planning and implementation of interventions. I've been a consumer of evaluations, and now I'm also a provider of evaluation services as a consultant. I've come to believe that interventions that we plan often do not always follow the neat linear script that we write in project proposals and texts. I also understood that the evaluations that we conduct must not only be looking at what happened, but also why and how things changed or did not change the way we expected them. I learned that the best way to do this, in finding answers, is to follow the causal pathways that change has taken through to happen. So this is why I'm interested to share with you today what I have learned in being part of this team. So I'm grateful for your presence here today, and I'm excited about that. Carolina already asked that participants introduce yourselves in the interest of time. You can introduce yourself in the chats. But what we would like to do now is to have a feel of who is in the room today. So Carolina will set us up in a small poll where we'll be looking at, we'll be indicating the type of organizations we represent, your role in those organizations, and your level of experience with causal pathway evaluations. The poll is on now. Please go ahead and vote. You can vote in Spanish or, in Portuguese or in English, and submit your vote. Thank you. So we have a very interesting presentation here that of who is in the room. I'm seeing the Portuguese slide now. A quite good spread of foundation people, non-profit people, as well as others from other organizations. We have a high number of evaluators in the room, and then we also have non-profit people who are eager to learn from others. In terms of your level of experience, a fairly good number, 35% have are new, and others have learned some kinds of pathway experience. And so that's a very good, interesting starting point for us to move on to learn. Thank you very much for participating in the poll and sharing your roles and experience with us. I'll turn over to Kimberly now to take us through the next steps. Thank you.
Thank you, Hippolyte. So let's take a quick look at where we're headed today. First of all, I'm so excited to have all of you in the range of experience in the room. I saw that about half of you are in that sort of top tier of just, I'm entering this and I'm just learning. So it's just so nice to see everyone here. But our focus today is building a shared understanding of causal pathways evaluation and getting more ready, both individually, coming to this conversation, but also wear your organizational hat, right? The organization is important to do this work well. And so that means surfacing some of the reasons this hasn't yet felt accessible or actionable and identifying what it really takes to help others move from curiosity to confidence. I can tell you that's where I started. I was very curious and I got more confident over time. So we're really glad to have this time together. As we get started though, just a few quick notes to ground us. First, this is a living training. We're continually learning and improving it, and we genuinely welcome your feedback at the end. Secondly, we're reserving time for Q&A at the end of the session. So you're welcome to drop questions into the chat as we go, or you can jot them down and bring them forward during our discussion. Our colleague Carolina will be capturing questions in the chat along the way. And if we can't get to everything live, we promise we'll follow up with you afterward. We're really, really good about that because we want to make sure you leave here fully with your cup full of understanding, with curiosity, and at least some of the answers to the questions that you have being answered and attended to. We're also really grateful to be joined by an interpreter, Sanandra Andrade of Brazil, who will support a guest who speaks Portuguese joining us. And so thank you for your time and contributions to this session. We really see you and appreciate the value that you're adding here today. And lastly, all the materials we shared after the session will definitely be sent to you. So no need to capture every detail that you see on the slides, unless you're an auditory learner like me. I tend to write everything even as I'm hearing it, but you can stay focused otherwise on the conversation and the concepts. And so now I'll turn it back over to Hippolyte.
Thank you so much, Kimberly. In our discussion today, we'll be using various key words, such as projects, programs, strategy, interventions, initiatives, All of these words have their own meanings when they're used in certain contexts. But in today's context, we will be using them interchangeably, so that if you hear them being used, do not be thrown off board because we're using them interchangeably, Traditionally, we've had an idea of what change to expect or established baselines and so forth. We are going to be talking today about a model that is not looking at a linear way of looking at things. We say interventions move from point A to point Y. So we have tools to capture and describe what happens. However, causal pathways tell us that beyond that, we need to see things differently. So we'll now be moving on to discuss what are some of the things that we expect to see when we compare descriptive evaluation to causal pathway evaluation. So we will look at slide 8 now, Carolina. Essentially, when we ask, you might be wondering what we mean by causal pathway evaluation. What is different or distinctive about it? To get us started, it can be helpful to compare causal pathways evaluation with what we are calling out as typical practice, what we are referring to as descriptive evaluation. Let us try to explain this with a look at the steps we take in setting up an evaluation. There are 4 critical steps that we take in carrying out descriptive evaluations. We always ask a question that we use to determine what questions that we want to ask in the evaluation. And then we get into design phase, where we collect the data. And then we have the measures that we use to do the measurements. And then, of course, we interpret the data. At each of these stages, there are different ways that Causal Pathways approaches this. So what we have here is a kind of a matrix that you see. At the ask stage, what we do in terms of the causal descriptive evaluations is to ask what changes are happening. But in causal pathway initiatives, what we ask is how and why are changes happening the way they are. So we go beyond the what to asking the how. At the design stage, descriptive evaluations will use a theory of change to describe what to measure. In causal pathways initiatives, we look beyond the change, we look beyond the theory of change, and expect interventions to evolve and contribute to our understanding of the emerging outcomes. And so when we do measurements in the normal descriptive evaluations, we usually measure intervention progress, outcomes, and context and assumptions. In causal pathway initiatives, yes, we will measure intervention progress. We will look at the outcomes and emergent factors, context assumptions, but more importantly, we'll be looking at how do the contexts and the outcomes contribute to each other. So we're looking at beyond what has happened, how has the context influenced what we are doing. So the difference lies in what questions we ask, what design thresholds we establish, how we intentionally look out for unexpected emergent changes, and try to understand why the changes we witness happened. Interpret the results. The theory of change is not the benchmark for the causal pathway initiative. Rather, in causal pathway, what we look for is the evidence that has emerged from the data, and that we can use as a primary source to infer whether, how, and why interventions or the context have contributed to the outcomes that we are seeing. So planned and unplanned emergent outcomes, we are looking for those ones. We don't stop at what has happened. We are looking for beyond that. Brief. So if you go against that background, let me turn over to Kimberly to explain further how we see the difference between descriptive and causal pathway evaluations. Kimberly?
Yes, thank you so much, Hippolyte. I just get so excited with the true explanation of what causal pathways are, because it's just something powerful about actually knowing how and why change happens. So thank you again for walking us through that comparison. It's such a helpful way to see the shift in the mindset and the method that causal pathways evaluation invites. To build on that, let's take a bit of a visual step back and think about the difference between descriptive and causal evaluation in a slightly more intuitive way. This is actually one of my favorite slides because it's actually how I genuinely learned about causal pathways. It captures a key distinction between the descriptive and causal evaluation. So first, descriptive evaluations are like holding up a mirror. They reflect what's visible on the surface. You can see who was involved. You can see what activities took place. And in some cases, you may see what outcomes were observed. And that reflection can be really helpful, especially when we're trying to understand the reach, the scale, or immediate outputs, right? But mirrors don't show us what's going on beneath the surface. They don't explain why something happened or what internal dynamics or conditions made change possible. So we're often left filling in the gaps with a lot of assumptions. And so causal analysis, thankfully, on the other hand, is more like an x-ray. It takes a bit more time and intention to set up, but it definitely gives us a view of the internal structure, the underlying relationships, the fractures, forces that are either enabling or impeding change. And when causal inquiry is done well and done in partnership, it doesn't just diagnose, it empowers. It empowers communities, it empowers funders, it empowers practitioners, who aren't just standing in front of a mirror, right? They're helping to make sense of the deeper story so we can make better decisions, align our strategies, and support more meaningful healing or transformation. Because ultimately, in complex systems change, you can't fix what you cannot see. So before we dive into today's content, I want to start by inviting you into a case that's personal. It's a causal pathways journey I've been a part of and one that I continue to learn from. So throughout this session, we'll return to it again and again to illustrate how the ideas we're discussing actually show up in practice. This will be our anchor and a reminder that causal evaluation isn't just theoretical. It's practical, it's definitely possible, and when it's done well, it's really powerful. So as you listen, I really encourage you to think about your own work. I mean, really center your work as you listen to this case, right? And where you might want to better understand how and why change is happening in your own context. So keep that in mind as we move forward. And with that, I'll turn it over to Hippolyte to help us step into the story.
Yes, Kimberlyn, you mentioned that you have a case study to help us walk through your experiences with using causal pathways. So let's dig into that right now and have you help us move beyond theory to practice. Can you tell us something about the project or strategy? Who commissioned that evaluation and why?
Yeah, absolutely. Thank you so much, Hippolyte. It's a great question. This case actually comes from a national foundation in the US that has been investing in areas like early childhood development, workforce equity, and job readiness. They were seeing strong performance metrics, which would include things like families served, trainings delivered, but eventually they began asking a deeper question. Are we really shifting the systems that are creating inequity in the first place? And that question honestly reframed everything for the entire foundation, especially the national team and the board. So rather than commissioning a traditional evaluation to prove impact, they wanted to better understand how change was actually unfolding and what strategies were working, under what conditions and for whom. And so they intentionally turned to causal pathways evaluation as a way to go deeper, not just asking kind of what happened, but they wanted to explore why, how, and for whom, and in what context. So it marked a shift from tracking outputs for the foundation to seeking systems level insights. And that's really at the heart of causal learning, Hippolyte.
That's interesting. So how did you get involved in this evaluation?
Yeah, so in my role, I often help set the table for learning. And in this case, I had a very strong, longstanding relationship with the Foundation's Vice President for Learning and Impact, who's very well known in the field, a key board member I happen to know, and also the head of the foundation. So that trust with those relationships really created space for me to introduce the causal pathways approach, not as a sort of technical fix, right? But as an invitation to think differently about how change really happens in the foundation's work. So I began with one-on-one conversations. Remember, relationships move at the speed of trust. You can do this too, folks here. And then I brought in the programs team. And then eventually I facilitated design sessions that included external partners and grantees. This foundation certainly believes in centering the voice of the community and their grantee partners. So that intentional sequencing really helped me build the buy-in and ensure that the evaluation wasn't something done to people, right? But something co-created with them.
Hmm. You mentioned several people who were involved, several levels of people, but who was the intended user of this evaluation?
Yeah, the primary users were the foundation's board and the program team, the national programs team. I should be clear, this is a national place-based funder, so there are other programs teams spread out throughout the country, but the national team and the board of governors. So the board was needing really credible, nuanced evidence to inform major strategy decisions, not just about where to invest their dollars, but how to invest in ways that accelerated systems change. And I think that point about acceleration is important because you don't have to wait for a very long time to see change happen when you're sort of being intentional about this. So the credibility of the process really mattered to the board, but so did the utility and the usefulness. So this wasn't about compliance, it really was about learning, which I really appreciate the foundation for leaning into. And because the foundation was committed to equity and learning, we knew our methods had to elevate diverse perspectives and not flatten the diversity of perspectives and the stories. So that was essential to both the rigor and the integrity of the work, Hippolyte.
So you've explained the impetus or inspiration for the evaluation. What were the specific questions they were trying to answer?
The core learning questions in our evaluation weren't about checking boxes, I can tell you that. They were about surfacing relationships and meaningfully understanding contribution in very complex systems. So we asked questions like, how did change happen across these workforce systems? Why did it happen? And what conditions or strategies enabled progress? We also asked who benefited, and importantly, who was left out? That's one of my favorite questions. We often can see the folks, right, in the mirror, but you can't see who's left out unless you think about that question. And then also, what role did the foundation's investments play already? And then finally, we asked what else may have contributed to the outcomes we observed. So these questions were designed to really invite exploration, not just measurement. We wanted to make space for complexity, emergence, as Hippolyte mentioned earlier in his remarks, and then also the lived realities of people closest to the work. So we also intentionally left space for iteration. I mean, this is progress, not perfection. And I really want to make sure that you all know that. You do not have to be perfect to do this. And no one is, by the way, we know that. So in culturally responsive and equity-centered evaluation, the questions aren't static, they evolve as new voices come into the room, as power dynamics shift, and as unexpected insights surface. So from the very beginning of this evaluation, we set the intention to co-create the questions with program staff, with partners, and with community voices to reflect not just what the foundation needed to know, but what people on the ground cared about learning too.
Complexity and emergence. This is something that's come up several times already. Accounting for complexity, iteration, and emergent outcomes are distinguishing characteristics of a causal pathway evaluation. The evaluation design assumes that the evaluation design assumes that the intervention has evolved. What methods or approaches did you use and why?
Yes, excellent question, because you definitely have to choose the right methods, and this is the point of this, to kind of introduce us, right? So to explore those big causal questions that the foundation had, like how and why change was happening, we used two core methods designed specifically to address complexity and emergence together. So the first would be ripple effect mapping, which allowed us to visualize and see the broader systems shifts sparked by different types of strategies, kind of like dropping a pebble into water and then tracing the waves. And in facilitated group sessions, grantees, community members, and even employers came together to map what had changed and sort of understand why it mattered and how it connected to the foundation's work. So it's a method built to really capture both the intended outcomes and the emergent ones together, the unanticipated ripple effects that often signal kind of deeper transformation. And now contribution analysis offered a structured way, though, to explore the plausibility that the foundation strategies contributed to the observed changes, while also asking what other factors might have played a role. It wasn't about claiming attribution, it was about tracing contribution with humility and precision. So what made these methods powerful is that they were participatory by design. So the insights didn't come from evaluators looking in from the outside. They were co-constructed with grantees, partners, and community members who lived the work, as I mentioned earlier. And as we know, in systems change work, that's not just rigorous, it's responsible and it's also equitable.
Hmm. So you mentioned two approaches, ripple effects and contribution analysis. I'm interested in the contribution analysis bit. Let's take a deeper look at it, contribution analysis, and the role it played in the evaluation. Contribution analysis starts with a theory of change. And in causal pathways evaluations, we don't want to be bound only by that theory. So how did you balance the tension?
Yeah, that's a really important tension to name, Hippolyte, because in systems change work, things rarely go according to a linear theory of change. I mean, honestly, the very notion in the beginning of learning about causal pathways work, I was like, wow, we've got to rip that theory of change up and challenge our assumptions. And it's actually my favorite part of the work. So we use contribution analysis precisely because it offers a structured way to test causal claims without assuming attribution. So we started by mapping the foundation's theory of change, yes, but then we layered in real world evidence that emerged through the ripple effect mapping that I mentioned, including outcomes that weren't anticipated but were clearly meaningful. And that allowed us to treat the theory of change as a living document, not a rigid blueprint. And I'll be honest, folks were like, oh my gosh, we are bound by this theory of change, but you could see the excitement and how it sort of unfolded for them to sort of release control and let go and let the process play out. So then we explored plausible links between the strategies that the foundation supported. For example, employer convening, storytelling, technical assistance, and the observed system shifts, changes in hiring policies, new equity-focused discourse, and stronger cross-sector collaboration. But we didn't stop there. In our sense-making sessions, we asked participants, the grantees, partners, and even residents, what else might have contributed to these changes? We asked them, we prioritized them, we saw them, which is really important in this work. So we looked at alternative explanations like economic trends, political shifts, or other initiatives in the field. And this wasn't a check the box exercise. I want to emphasize that. It was really essential to be honest about complexity and about power. So when we make causal claims, I want you to know that we have to be able to say what we know, why we think we know it, and who helped us reach that conclusion.
Hmm. Yeah, I want to underline what you just said about alternative explanations and why they are important. Outcomes are usually the result of both the intervention and the context. Did the evaluation gather any evidence on those other contributing factors?
Yes, and this is an area I've been reflecting on deeply, honestly. The evaluation team conducted a desk review and a handful of interviews to surface some contextual factors, but most of the insights came through participatory sense-making sessions. Remember, I said this was participatory by design, and I'm so glad it was, because that process of bringing people together to collectively weigh different possible explanations was really powerful. And they appreciated that. The community really did. So still, though, if I had the chance to do it all over again with what I know now about causal pathways evaluation, I would build in more intentional data collection around context, Hippolyte. That could include stakeholder interviews focused specifically on system dynamics, or maybe trend analysis to better understand external shifts and overlapping efforts. Because acknowledging context isn't just good evaluation practice, in my opinion, it's also a matter of equity. And it honors the fact that change is co-produced by many actors under many conditions. And it helps us to avoid overstating the role of institutional power in outcomes that were deeply collective. So yes, alternative explanations do matter, and they deserve the same rigor and humility we apply to our own contributions.
You have a sample pathway to share with us so that we can see how what you mean.
Yes, thank you, Carolina. So as you can see, let me share one of the causal pathways that emerged from this evaluation. It's a great example of how change kind of moves through a system in nonlinear, layered ways. So this began with storytelling, as you can see. Job seekers kind of shared their experiences of exclusion and opportunity with local employers and workforce leaders. But those authentic stories created the urgency and sparked public comments, and actually public commitments from employers, statements of their intent to change, which started to build pressure and external accountability. And then those public commitments in turn led to internal shifts in HR policies, things like rethinking hiring criteria, adopting fair chance practices for those who are formerly incarcerated, and integrating equity goals into recruitment pipelines, right? Which is very important in this kind of work. And at the same time, there was technical assistance and peer learning among nonprofit partners that helped spread and scale those shifts across a broader network of employers, creating the ripple effects that far beyond the original engagement. So here's the key point I want to make. None of this happened in a straight line, as you can see in this graphic that we tried to put together. No single action or strategy caused these changes. So the evaluation revealed a web of reinforcing efforts, advocacy, relationship building, policy engagement, narrative change, all interacting over time to shift not just practice, but a mindset. And that mental model is really important in this work. So that's the power of causal pathways evaluation. It doesn't flatten complexity. It helps us trace and honor it.
That's an important point to make. It doesn't flatten complexity. It helps us to trace and honor it. So what changed because of this evaluation? Did the foundation adjust the strategy based on the evaluation findings?
Yeah, the foundation didn't just adjust its grant making strategy, it actually reimagined how it learned. So remember, I mentioned that their commitment to learning. I thought that was really compelling as they reflect. If they were here today, they would definitely emphasize that what began as a learning exercise for the board and the national program team quickly evolved into a broader cultural shift for them. So they started to build strategy with partners at the table, not just on their behalf. They asked more generative questions, and they began investing more deeply in long-term systems change, not just program success. And the board used the findings from this evaluation to inform really critical decisions about where and how to focus their resources. And they gained a clearer understanding of what it really takes to move the needle on equity at a systems level. And that is something that folks are trying to figure out even now. So perhaps most importantly, they became more comfortable with complexity, more curious about what they couldn't predict before, and more confident using non-traditional methods to explore it.
That's such a great example. Looking back, what stands out for you?
Yeah, Hippolyte, what stands out for me most in this case offers a few key reminders that I want to lift up. So one, that causal pathways evaluations don't require randomized control trials to be credible. I just want to pause there. This is a key fact. Also, that participation enhances rigor. It doesn't dilute it, right? It's important to engage folks in this work, especially those most proximate. And that sometimes the more powerful question isn't, did it work? It's what contributed to the change and how do we actually know, right? So when we shift our questions, we shift our possibilities, which is one of my favorite words. And in this case, it helped a major foundation move from tracking activities to truly understanding impact. And that's what makes causal pathways so powerful. It expands what's possible when we shift how we ask, learn, and act. And for me, that really stands out, what actually really stands out the most from studying and leading this evaluation with a team is how much trust and openness to learning are required for everyone involved. As an equity-focused evaluator or culturally responsive, equitable evaluator who came from the philanthropic sector with a practitioner lens, I've been a funder, I've been a board member, right? I actually had to go deeper in my own practice, not just methodologically, but relationally. I had to be willing to hold space for the emergence that Hippolyte talked about earlier, to follow complexity rather than simplifying it. And I had to also really authentically honor the perspectives of those closest to the change as legitimate sources of causal insight. So it reminded me that causal pathways work isn't just about technical tools, it's about cultivating the conditions where truth telling, co interpretation, and systems learning can actually happen. I also saw how valuable it is when funders are willing to let go of that rigid expectations and lean into discovery. Remember, I talked about when I could see the light bulb when they were seeding power, right? It's powerful to do that, right, in and of itself. That's when evaluation moves from being a performance exercise and punitive, right, to a real learning journey, and one that not only informs decisions, but it deepens relationships and shifts power, especially with grantee partners and even internally at the foundation. So, reflecting on this experience, I've asked myself, what does this mean for me moving forward? And so for me, and perhaps for you listening to this, it's a deeper commitment to, it's a calling in, not just to answer evaluation questions and causal questions, but to using these approaches to support collective strategy, equity-centered learning, and ultimately more responsive systems change. Thank you, Hippolyte.
Thank you so much, Kimberly, for taking us through your case study. Let me tell you one of the reasons why I find this case so useful. In planning the evaluation, the foundation and evaluation team looked beyond the theory of change. They expected the intervention to evolve, anticipated new insights about the context, and welcomed the emergence of outcomes they hadn't originally planned for. The evaluation was designed to gather evidence on all of those things and to use that evidence to better understand how and why both the intervention and the surrounding context contributed to the outcomes, both planned and emergent. It also shows us that causal pathways in evaluation itself can grow, that evaluators and funders alike can expand their approach to as they lean into complexity and learning. Thanks, Kimberly, for sharing that example. I learned a lot, and I hope others on this platform are also learning about that. But I do have a question. So let's look close. Let's take a close look at the session, reflect on what we've learned from studying this case. Ultimately, causal pathways evaluation is about making a difference in real people's lives. It ensures that strong evidence informs the decisions that matter most to them. And we've seen that it takes many kinds of people and perspectives working together to conduct this kind of evaluation and close the learning loop. With that in mind, we now are going to look at what's holding us back. What myths or assumptions might be getting in the way of exploring causality more deeply? So these are the questions that we need to ask ourselves. What is holding us back? Now, in thinking about what is holding us back, there are and will always be reasons why we shy away from exploring new ways of learning. And I am sure we could easily generate 1,000 reasons, or 1,000 of reasons, if we tried to do that among us. But let me move on to the next slide and share with you some myths that we have discovered as a group working together that are holding us back from using causal pathways initiatives. So the myths that we have, there are 4 types of myths we observed. Myths that get in the way of improving our practice of causal pathway analysis. We will address each of them. Remember, the point that Kimberly has made in this case is that it takes many types of people playing many types of roles to conduct a successful causal pathways evaluation. That's important to keep in mind while we unpack these 4 myths. That's because some of the points are going to be more relevant to some of you than others. Some myths are relevant to a broad range of people who have put into commissioning, managing, and using evaluations. And 2 of the myths are more relevant to those that contribute to methodological decisions about how to conduct an evaluation. Those will get a little technical, so bear with us. The myths that we have. The first myth is about myths about who can participate and who benefits. And usually there'll be a lot of discussions about who can. Kimberly has already mentioned several people participated in the case study that she shared. But we can have long debates about who can participate. Are community people important? Are staff important? Should program officers be involved? No, or all those kind of things can go in. So, and then we can get bogged down and make decisions about who can get involved and not get involved. And that can limit the participation. Remember what Kimberly said, participation is key. We need several voices, several perspectives to make change happen. There's also the myth about the design. How do we design the causal pathway and is it useful at any rate? Because we might be discussing, but we're doing all this already. We do contribution analysis. So what's the point having another process to define this? That can be a myth that holds us back from trying causal pathways. There will be a myth about, aren't we already doing this? Again, to the point I made about contribution analysis or ripple effects or other methods that you use for data collection. And we'll make the case that we are already doing this. So what's the point? But what we're saying is that causal pathway takes us beyond the what to the how and why. And so the processes for doing that, bringing in a lot more people and taking the time really to make the design work is a key factor that we need to take into account. And finally, there be questions about the methods. I saw in the chat already a question about, but should we start with descriptive evaluation and then move on to causal pathway? And somebody might say, oh, we already have contribution analysis, we already have participatory analysis. So is there any need for us to make the changes? What is important for us to remember is that this is very important to go beyond that. And if you are interested in digging deeper into this topic, we'll recommend an article entitled The Lost Causal. It's available on the Causal Pathways resource page. It was originally published in the Foundation Review and written by two of our colleagues, Julia Lynn, actually more, Julia Lynn, Sarah, and Julia Kaufman. Let me now allow Kimberly to take us more through the myths that we just mentioned. Kimberly?
Absolutely. Thank you. And I promise you, I'm going to try to answer as many questions as I can in the chat while Hippolyte is speaking because I find them fascinating. But just bear with me here. But one persistent myth is that causal designs are too extractive, especially in community-based settings. I'll be honest, I thought that at first. So I'm actually a living example of someone who came around to understanding the power of this. And I just adore Julia, Carolina, and both Julias for the work that has been done. But when done really thoughtfully, causal approaches can actually center community voice rather than marginalize it. And so these methods don't have to rely on rigid surveys or abstract models. Tools like ripple effect mapping, which I saw in the chat, which I'll get to hopefully, participatory sense making and narrative analysis draw directly from lived experience to explore how and why change is happening, right? So instead of extracting data from communities, these approaches invite communities into the meaning-making process using visuals, dialogue, storytelling to make complex systems more understandable and more actionable. So as evaluators or foundation leaders, or however you come to this conversation, when evaluators create space for community learning and incorporate the multiple ways of knowing, because there are multiple ways of knowing, causal analysis becomes not just accessible, but truly empowering. And so another myth is that causal designs are inherently rooted in white dominant frameworks or only serve top-down philanthropic goals. But causal analysis itself is really not the problem. It's how and by whom it's actually practiced. And I had to understand that myself. So there is a long tradition of non-experimental causal methods that you probably are aware of, many developed by indigenous scholars, participatory evaluators, and global communities, some even represented in this virtual space, that uplift multiple truths, not just single narratives. So these approaches can interrogate dominant assumptions and test what we think we know and surface community-defined pathways to change. In fact, when we use causal approaches with intention and humility, they can actually shift power, generating evidence that is more useful, more just, and more aligned with how change really happens in the world. So the truth is, causal analysis doesn't have to narrow what we see. It can actually expand it. It's a tool that, in the right hands, can support equity, deepen insight, and honor complexity. And so moving along here, I want to share that one of the most persistent myths about causal analysis is that it's too burdensome for participants, especially in complex community-driven settings. And it is true that meaningful causal evaluation requires engagement, but let's be clear, engaging those closest to the work isn't a burden, it's a strength. And I would argue that you can't afford not to. But these are the people with the deepest insights into how change unfolded and why it actually mattered. So the real issue isn't the time that it takes that Hippolyte was talking about earlier, it's how that time is actually used. So when participation is purposeful, respectful, and grounded in shared learning, it doesn't feel extractive. It actually feels really affirming. And I can tell you, as a firsthand experience, the community appreciates it. It also builds trust. Remember, I said earlier that relationships move at the speed of trust, and that is certainly true in evaluations. It surfaces new perspectives. It also creates space for those often left out of strategy conversations to meaningfully shape them. But we also need to rethink how we define burden. Too often, we only talk about the effort required when what we really need to think about is the return. I often say that in the philanthropic context, this work is about return on investment as much as it is about return on relationships. And so evaluations that only prescribe or describe what happened often fall short. They offer limited insight and little payoff for people who contributed their stories and their time. But causal approaches, when done well, help us understand how change happened, why it happened, what conditions actually made that possible. So that's the kind of insight that communities can actually use. They can use it to improve, to advocate for policy change or any kind of change they want to make more strategic decisions as well. So in the evaluation I referenced earlier with the National Foundation focused on workforce equity, we didn't just gather data from partners. We invited them into the learning process. So through participatory sense-making, nonprofit leaders, community advocates, and even employers came together to map the ripple effects of their work. And someone in the chat asked about ripple effect mapping. I can't wait to explain it deeper. So they named unexpected outcomes. They challenged assumptions, and they offered alternative explanations for the changes we were seeing. And many of them told us that the process itself was valuable. And I need you to let that sit for a minute. The process is valuable, that it gave them the language, the clarity, the momentum to guide their next steps. And so that's the goal. It's not just to collect insights, but it's to return them in ways that inform, empower, and energize. So in closing, I want to share that when done right, causal pathways work doesn't burden communities. It really honors them when you really reflect and think deeply about it. And it transforms evaluation from something extractive into something truly equitable, useful, and generative. And so another common misconception I want to walk through is that causal designs are only backward looking. I've heard that so many times, and that they're just about unpacking the past, and they don't have much to offer when it comes to making strategic decisions about the future. But in reality, understanding how and why change occurred is essential to refining and improving strategy, especially in complex systems, especially when things are changing so much, right? So when causal analysis is done well, it helps organizations see a few things. Which efforts contributed most to the outcomes they care about? under what conditions those contributions actually held, and for whom the change was most meaningful or least felt. And so that level of insight does more than explain what happened. It actually informs what to do next, right? There's a future orientation here that we often miss. And so I really appreciate how it allows organizations to challenge untested assumptions. Your theory of change or the theory of changes you engage, sometimes they don't test assumptions. So it gives us this opportunity to spot the leverage points and identify more equitable and effective paths forward. Hippolyte?
Thank you so much, Kimberlyn, for explaining the myths to us. The particular myth that I'm worried about, thinking about is, how does it apply to strategy? No, this myth is particularly tricky because on the surface, it sounds reasonable. Many evaluations do descriptive change, they connect activities to outcomes, and they make causal claims. But let's think back to the beginning of the session when we compared descriptive evaluations to causal evaluations. And we said that descriptive evaluations observe outcomes and use the program theory of change to explain how the strategy contributed to those outcomes. Often, those causal claims are inferred rather than tested with evidence. That means that the evaluation relies primarily on logic and reasoning rather than evidence to bolster the claims. To put it clearly, just because an evaluation measures outcomes doesn't mean it has applied a rigorous causal lens. If we stop at describing and reasoning, we will be reinforcing the very assumptions that we set out to examine. With causal apartheid evaluation, we dig deeper. We make assumptions explicit, we consider alternative explanations, and we test the evidence. We test them with evidence. Do we do that? What methods can evaluations use to examine causality more closely? We'll run into a few myths there too. And those myths will include the questions about rigor and how they relate to experimental designs or non-experimental designs. When we start to talk about rigorous examination of causality, one of the first issues that comes up is the idea that randomized controlled trials or quasi-experiments are the only ways to test cause and effect relationships. For the next few minutes, we are going to talk about the decisions that an evaluator makes in crafting strong designs. I'm going to use some of the specialized language that evaluators use. If you are not an evaluator, don't worry. I'm going to explain these terms in ways that you can understand them and why you shouldn't worry about that. No. And if you are an evaluator expert, I'm going to be making some generalizations and simplifications to make the point. There are two main families of thoughts when it comes to exploring causal relationships. They represent different perspectives on how the world works and how to influence change. RCTs and quasi-experiments are in the counterfactual family. In this family of approaches, causal relationships are conceived in a linear, one-direction way, which basically makes the argument because A and B happens, or because A, that's why B happens, or because A and B and C, then D happens. To uncover these causal relationships using random control trials or quasi-experimental methods, two things must take place. First, the interventions must be conducted with fidelity. The key elements of a strategy must not change or adapt, and they must be implemented in a uniform manner. The second is that at the same time that you are conducting these trials, the evaluation must also measure a counterfactual or an alternative version of the program, or a no program at all version. Program participants must be assigned randomly to either the program or the counterfactual, and often depends on a high volume of cases. As a program person, you can realize that that's not feasible or ethical to do in all cases. That's one reason why RCTs and quasar experiments are not appropriate in all cases. Causal pathways in evaluation methods are in the generative family. Generative approaches assume that there are many different factors, and A may only lead to B when preceded by C and D, E, F, and E and F and are present. There may be many causes and effects, some outside the control of the intervention and some within it. Causal relationships may be complicated, that is, many factors of varying weight and placement in the causal pathway may come along. There may be feedback loops. Even more than that, generative approaches also recognize complexity. That is, sometimes causality cannot be predicted, and that there may not even be one understanding of how and why and under what conditions change has happened. To uncover causal relationships, generative approaches also seek rival explanations, but not with counterfactuals. High-quality causal analysis outlines pathways of change, triangulates data from multiple sources to examine specific links in the causal chain, and interprets evidence collaboratively with people close to the work so that their voices and their views, their experiences can help uncover what made the change happen and possible. Even if you are not an evaluator, I hope that it's clear that generative approaches represent a different view of how change works in the world. I hope I have tried to explain that. Now, there are also some other myths about non-experimental designs for examining causality. Let's walk through that. Let's look at some options for exploring causal explanation for strategies or interventions that embrace adaptation and emergence. The evaluation that Kimberlin described used a combination of contribution analysis and ripple effect mapping. This slide lists a sample of methods that can be effectively used in causal pathway evaluations, and you can see all of them on the slide. They are organized in three main groups. There are theory-based ones, 6 illustrative methods, including contribution analysis. We also have the participatory narrative approaches, which have 5 illustrative methods. And we have 3 methods that are considered as systems-based methods for doing this. The methods listed here are good starting points when designing an evaluation to explore causal relationships that are complicated or complex. Each method has its strengths and weaknesses. It may be helpful to combine 2 or more approaches. One method may be able to address the weaknesses of another. We recommend working with an expert evaluator to make design decisions. Causal analysis in these methods can be strengthened through a variety of techniques, such as increasing the examination of alternative explanations, triangulation of data, and so forth and so on. So you have on the slide these different ways in which you can apply the causal methods and approaches you can use to collect data for causal pathway analysis. The key takeaways for me is that philanthropy already operates with a causal mindset. Every strategy is essentially a hypothesis about how change will happen. Now, we want to go beyond thinking causally to build the capacity to understand whether and how those hypotheses hold in complex real-world settings. It's about moving beyond descriptive evaluation and investing in understanding causal pathways. So this investment is worth it. This kind of learning does not only strengthen strategies, but also challenges assumptions and uncovers insights that can shift resources towards what's actually working. When we make causality visible, we create the opportunity to be more adaptive, effective, and equitable in our approach to change. This kind of causal learning doesn't require us to default to randomized controlled trials or quasi-experimental designs. The field has a growing suite of robust non-experimental methods that are designed for the messy realities of systemic change. These methods are most rigorous when they are participatory. When people affected by these strategies are involved in naming and interpreting causal relationships, the findings are both more accurate and more actionable, and in fact, they identify with them more than they would otherwise. When those closest to work are not just respondents, but co-interpreters and meaning makers, they use the evidence that they produce becomes more acceptable, useful. Rigor and participation aren't trade-offs. They are mutually reinforcing. So this is how we understand the issue of rigor in using the causal pathway analysis. We will now go into small groups where we will have a chance to discuss what we've learned. But before we head into our breakout rooms for discussions, let's do a quick poll on myths in your organization. In your situation, which myths are informing decisions about whether and how to explore causality? You have the questions there. Make your choice, make your vote, and let's move forward. Okay, so we have some results coming in. In the first question, myths about methods scores 45%. No, that is one of those that hold people back. Myths about whether causal designs are useful gets 35% votes. That's something that holds them back. And myths about whether we are already using it, 80% have made that score. Thank you very much for indicating what myths are likely holding you back. And I'll now turn over to Kimberly to take us into the small groups.
Okay, so I'm excited. Thank you, Hippolyte. I always learn when I hear you talk about the causal pathways, working, going deep into the methods. So thank you again. I actually love this small group exercise because you never know who you're going to network with and who you're going to engage with and stay in touch with. So we're going to move into our first small group breakout. You'll have 10 minutes to connect with one another and briefly explore the question on the screen. So the question is, what myths or assumptions do we currently hold in our organizations about whether and how we should explore causality? So we've listed a few common types of myths to help spark conversations. You see the myths about who can participate and who benefits, myths about whether causal designs are actually useful, myths about whether we're already doing this work, even if we're calling it something different or not calling it causal, and myths about methods themselves, like what counts as rigorous or credible. So there's no need to get too deep just yet. This is a chance to kind of meet your group, get warmed up, and begin surfacing some of those shared beliefs that might be holding us back. So we'll give you a minute warning before bringing you back to the main room. So enjoy your conversation, and we'll see you soon. Carolina will whisk you away, as they say.
Great. Thank you, everyone, and welcome back. So, do we want to share what we discussed in our small groups? Meeting room one, do you have any thoughts to share? Is everyone back?
I was in meeting room 3. I can go ahead if no one else wants
Please go ahead.
to.
Please go ahead.
Uh,
Yes.
so uh, Nikhil and I were in the same breakout room, and both of us had come from more rigorous quantitative methods perspective into the world of more systems level change. We did not talk so much about whether our organizations have problems with it, but just around I was talking about the difficulties with engaging with participants in some cases. Even when you have relationships, unless you really figure out a few key places where the participants already go, it does not
Mm.
matter what compensation you provide, it doesn't matter how short it is. It doesn't matter if you offer virtual or in person, unless people already are in a specific place and they feel safe to share their perspective. So, to give you an example, there was one scenario in which we thought it was great that the school facilitated a family focus group, and in the principal, either um, inadvertently or purposefully staying on to support another so that particular one was a hybrid workshop, a hybrid focus group. And essentially what happened was, by that principal being in that space, nobody said anything but good things. And we knew that it was not a perfect world in which everyone was happy with everything that was happening. And so ever since we have been more, and even if you don't have the principal, if you know it's all the families of the same school, you may not have that sense of psychological safety to say things because you think that it might go back to the school. Whereas when we work with a community organization where families are already going, there's a greater diversity and we do get the perspective. So there's a lot of learning that happens through trial and error, and it's not perfect. And in our case, we don't call it causal pathways um, evaluation particularly, but we do use participatory methods. The part that I liked the most about today's presentation is really thinking about those giving weight to the alternative
Mhm.
explanations. And often what I have found is that as a nonprofit, we are unclear on what is the extent to which we're having to show that we singularly made a huge impact, whereas the reality of it is much more complex. Was there legislative support? Was there state funding? Were there these three other things that were happening at the same time? Were the families feeling safe to show up to school, to attend a workshop? And so I appreciated that this approach was really taking that into consideration. And in our evaluation work, we do tend to provide that context because we have a really close relationship. We are internal evaluators, which really helps. But I know as external evaluators, we don't often have the same kind of privilege of knowing everything that's happening on site.
Thank you so much. Thank you so much. Any other thoughts from the other rooms?
The teacher in me is like, there's at least one other share. That was excellent.
Yeah. Yes.
I'll share out that one of the things I raised is that the burden on community is a real decision
Mm.
criteria, and I appreciated how that was addressed in the first session. But I sit in a philanthropy learning department, and there are some times where we have to ask questions that don't feel like they would add value to the folks in the field. And so I still have to really balance how much of that, like, when thinking about participatory methods, how much to ask of our participants.
Thank you.
Thank you. Thank you very much. Any other thoughts before we move on to a break session? Thank you for those ideas, for
Yes,
those
I would like to.
thoughts. Please go ahead.
Yes, I was in the same breakout room with Heather, and yeah, I was sharing that I'm actually working on evaluating education program. It's a public policy, so we are looking back then try to forecast what's coming up in the future. And yeah, the main myth that we are facing is about participation and who can really benefit from all of this at the end of the day. And the problem of defining our public, are we listening just to um, school directors, or are we listening to students, to their parents, to the teachers and stuff like that? So we do have limited time and resources, and yeah, it's almost impossible to get everyone in the to listen to everyone and get everyone to participate. So this is kind of a problem of, yeah, maybe time and resources. So how to reach the right balance of how many people, how many perspectives you will have within the room. So this is the main problem that I'm facing right now. And yeah, I think it's related to the first problem on the participants and who will benefit from it. Thank you.
No, as that's a very strong point you make. No, as Kimberly mentioned in the earlier point of our presentation, this requires an investment. No, but an investment in which we look for the returns, not just in terms of what results we're getting now, but how does it inform future programming, and that's an important part, a consideration to make. Thank you so much for everyone for contributing your thoughts from your group discussions. I turn it over to Carolina now to help us with the process of going for break and coming back.
Hi, everyone. We're just going to take a quick 2-minute bio break. So feel free to go get water, go to the restroom, whatever you need to do. And we'll be starting in about 2 minutes.
Cool. Okay, thanks for sticking in with us. I promise you, you want to stick to the end because we are going to continue this learning journey and we can't do it without you. So thank you so much for just hanging in here. So, convincing initiative or program teams of the value of exploring causal pathways often starts with something bigger, helping them see the value of learning itself and how evaluation can support that learning in a meaningful, not burdensome way. And I like that we're kind of shifting here into like existing curiosity and sort of talking about the change processes because many of you are kind of lifting this up in the chat. But I want to highlight that that's a broader challenge in our field. But in my experience, teams working in complex systems are already asking really deep questions about how change actually happens. There's usually a natural curiosity we can tap into. So from the start, most teams are making some sort of hypotheses, whether explicitly or not, about how change will unfold. And once implementation is underway, they start to see what's working, then they see what's not working, and they have evolving assumptions and observations that deserve some attention. So instead of starting with evaluation methods or jargon, I often begin with a simple invitation. And that's the question: when it comes to the changes you're trying to create, what are you most curious about? And so meeting people at their point of curiosity is what I like to say. So that kind of question, honestly, it shifts the energy. It opens the door to conversation, and it often leads naturally to exploring causal pathways together. We don't have time in this session. I encourage you to go to the next two causal pathways trainings, but that scenario about the principal and the school, it's fascinating. My partner is a principal, and I'm just like, oh, I just want him to talk about it, right? But the point is, there's a lot of work to uncover and unpack here to hold up that mirror and x-ray with that principle here with these methods. But we can't just get there without trust, right? And trust really builds when we as evaluators understand the context and we honor the work and show up not just as technical experts, but as learning partners, or what some call critical friends. And so that's the role we get to play. We're not going to judge, but we want to walk alongside teams as they figure out what's really driving change. And so moving on to the next piece here, if initiative teams haven't really seen real value from past evaluations or learning processes, we may need to take a different approach, one that meets them where they already are. Like I mentioned, that point of curiosity. So rather than trying to introduce something entirely new, someone mentioned that they call it something different because it's participatory. We can also look for moments when teams are already reflecting or asking questions, whether formally or informally. So here are a few natural entry points. You can look at strategy meetings when teams are shaping or revisiting their approach. We have a foundation leader here, a representative who talked about that, their foundation and kind of where they are and asking questions and how to engage. You can also do grantee check-ins, where they're noticing what's actually shifting or what's not shifting with grantees. And also you can a natural entry point that I've seen is the routine monitoring activities where data might spark some sort of curiosity or raise new questions. And so these are great openings to ask a simple question instead of questions like, what are you noticing? What are you wondering about? What might be contributing to change or the lack of change? And so that kind of curiosity is often the door to exploring causal pathways. And we're going to stay right here on this slide to share that, once we've actually found those natural openings, the strategy meetings, the grantee check-ins, or monitoring activities, we can actually start to listen for the kinds of questions people are already naturally asking. And often they're not using the language of causal pathways, as someone mentioned earlier, but the curiosity is already there. And so they're wondering things like, what would it take to make progress toward this particular outcome or set of outcomes? How will we know if that's working? How has this change come about in the first place, right? What contributed to it? How do we know? These are all questions that open the door to exploring causal relationships, and they can come, really be powerful entry points for a deeper learning conversation. And so the key is that we don't have to lead with evaluation frameworks or technical methods. I think that's really important from a trust to relationship building standpoint anyway, especially if you have learning and evaluation divisions in a foundation and program officers on the other side of the house. It's sort of uncoupling opportunity to naturally engage in the work. The key is that we want to start with these questions that matter to them, and then we build from there. And so Hippolyte, I'll turn it over to you now.
Thank you so much, Kimberly. We don't have to lead with evaluation frameworks or technical methods. No, we need to start light, offer lighter touch ways to begin to answer causal questions. That is, ways to maximizing quality and rigor within real-world time and resource constraints. Somebody mentioned that in our debriefing, resource constraints as an issue. What's important here is to move in the right direction of deepening causal exploration as we can, acknowledging remaining limitations, biases, or gaps in quantity and quality of data. Two approaches that might help us to go beyond this is to begin a journey of causal pathways by exploring after action reviews as a way to understand, which might already be familiar to many of you, but it's a way to reflect on particular action or campaign. After action reviews can be tweaked to include causal questions. Ask not what happened, but also how a change did or did not come about, for whom, and under what conditions, and what difference did it make. Invite a critical friend to join the after action reviews as a way to triangulate the data from staff or partners and increase the credibility of findings. A critical friend is familiar with the situation and is independent. Storytelling is another approach that we can use to offer another good starting point for causal pathways exploration. Storytelling is something most people do naturally anyway, making it less burdensome than other data collection processes. If drawing out a story from a storyteller can be structured to ask about changes, how they did or did not come about, for whom and under what conditions, and what differences they made, then we can begin to understand some causal pathways. Eliciting stories about the same change from different storytellers can help triangulate and increase the credibility of what was learned. In both cases, additional triangulation can be done through reviewing relevant documentation to support what you already know. Of course, when beginning to explore causal pathways in these ways, we must remind ourselves and our initiative teams that this is just the beginning of the journey. Deeper inquiry is required to truly understand causal pathways. Nonetheless, this starting point can provide useful insights and plant an important seed that can stimulate curiosity and interest in learning more. Other ways to encourage initiative teams to engage in causal pathways exploration might include the following. Engaging with those closest to the work in addition to working with power over decision making. Those closest to the work of making systems change are often asking the causal questions, and they might be more open to exploring and questioning their hypotheses and assumptions. The second thing is letting go of the language of causal pathways evaluation to listen for language that will resonate with people you are working with when exploring the ways that change happens. Moving away from evaluation speak, and use stories, metaphors, use art, visuals, musical media to engage people visually and emotionally in ways that will resonate with them and within that culture. It's important. Let us move on to explore what it takes to explore the use of causal pathways. Getting ready to explore causal pathways means bringing all the elements together. There is the buy-in, clear use. There's much to learn, limited prior evidence demonstrating that the change strategy leads to the desired outcomes. There's a learning infrastructure to support use of causal pathways learnings. We are asking now why, for whom, in what context, what change is happening, in what context change is happening. We are questioning our assumptions. We capture emergent outcomes. We use evidence rather than theory of change to explain how contribution happens. You can draw a lot. We have drawn a lot on this from the work of Julia Lin and Marina Apgar in the book chapter Exploring Causal Pathways Amid Complexity on page 21. So you may want to learn more about this from that book if you can lay hands on it. And in general, what we're doing in causal pathways, we're asking how, why, for whom, and in what context change is coming about. We are open to using this information to changing our strategies in response. By the way, we is not just evaluators, not just program staff or other donor staff. it is also the partners on the ground, the people engaged in making change happen, including those with the systems who are advocating and acting as part of the system change themselves. When we say we, the aperture can be very wide. We are open to challenging our assumptions and how change happens. We are interested in emergent outcomes. These might be positive or negative, and we shouldn't be afraid to embrace them. There's much to learn about a strategy's effectiveness and how change is coming about. Often this means there's not much prior evidence demonstrating that the change strategy leads to the desired outcomes in a particular context. In other words, uncertainty is sufficiently high about how change really happened and is happening now to justify investment in deep causal analysis. There is a clear use for what we will learn. If we are curious about how change happens, open to testing our assumptions, interested in the unexpected, and recognize there is much that is unknown, we are in a good position to want causal pathways work. We also need to be open to using the results. For example, to adapt the strategy, to communicate with others doing similar work, and to plan a new strategy altogether is critically important. The next slide here will present us with some message shared in the previous slide, but in different forms. So you can see that slide here. I'll turn it over now to Kimberly to take us through to the next section. Thank you, Kimberly.
Of course, thank you. So before we move into our next section, we'd actually love to hear from you. So I want you to take a moment to reflect on your own context now that you've gotten to know some other folks in a group. When it comes to strengthening causal pathways evaluation in your organization or your work, just in case you don't work for an organization, what's the bigger challenge right now? Is it building buy-in, which is like helping decision makers see the value of this kind of evaluation? Or is it readiness, strengthening your teams or even your partner's evaluation practice so you can move from describing what happened to really understanding why and how it happened? So Carolina, thank you so much. We've launched this poll for you to just quickly capture your responses that will help to actually shape in real time how we guide the rest of this conversation. So thank you in advance for sharing. All right, so let's see, we're gonna give you like 30 more seconds and we'll see your results. Okay, look at that. We're almost kind of split half and half here. Most of you, though, are at the readiness, strengthening evaluation practice. And then 42% of you are like, we're just trying to like reflect on it and build buy-in, which is still the main challenge. So what we're going to now do is send you into your second breakout group. You'll have about 10 to 15 minutes to connect and talk through one of those core challenges based on how you answered this poll, either in the buy-in category or the readiness. And you get to choose whichever feels most relevant to your work right now. So if you're choosing to focus on buy-in, we want you to consider what approaches seem really promising in your situation. Who might be a key ally or influencer to help build support. And I'd encourage you to think about the Causal Pathways Initiative as an ally and network for support. That's why you're here. You're a part of the network now. Thank you for joining us. And then if you're focusing on that readiness piece, think about how might you help an initiative team begin or deepen exploration of causal pathways, and what causal questions might naturally surface as they explore ideas. And again, we're a network as well, so this is a chance to reflect, swap ideas, and learn from each other. Remember, I said you never know who you're going to meet in these trainings, so this is a great opportunity to have time to check with others and what they're experiencing. So we'll give you time and check in as we near the end, and then bring everyone back for a brief share out. Karen. Okay. Okay, all good things come to an end or transition, as I like to say. So I do want to, we don't have time for all the groups, but I just want to hear one quick pithy sort of reflection. If someone feels compelled to share, please do so now. Anyone want to share, considering colleagues who will be listening to this recording later? Anyone? If not, we can move on. Jump in. Okay, hearing none. Before we close, I want to invite a brief moment of reflection to anchor today's learning in your own work. So think about everything we've covered here today, from the core concepts and the myths we unpacked to the case we discussed and the readiness questions we explored. I want you to take a moment to consider, what's one myth you're ready to challenge in your practice, or one shift you're currently inspired to make in the approach, and how you actually approach evaluation or strategy. So feel free to drop in the chat or note it privately. It's your personal takeaway as we move forward. So we have some more resources, for you to sort of take a look at, to explore causal pathways here in the next slide. And we know that today's session is just the beginning, as many of you want to go deeper. So the Causal Pathways Initiative offers a range of resources to support you wherever you are in your journey, from building understanding to put it into practice. And so on the left, you'll see we offer presentations and trainings to build awareness and will. You have probably seen us present at Grantmakers for Effective Organizations, the American Evaluation Association, and we're available to join other events by request. So we also offer virtual one-on-one level training that you're a part of right now that could also be customized for your team or your organization. So in the center, we've also curated, resources to support understanding and action. So the betterevaluation.com hub, which we posted in the chat in this session on causal pathways, is a great place to start. I actually learn a lot from there frequently. I especially recommend the pages on relevant methods and the bricolage design approach, which embraces iteration and complexity. Then also the Clarissa case study by our colleague that Hippolyte mentioned earlier is another valuable example, and the supplemental materials that go into great depth about the methods and process used. And if you're looking for guidance on how to get started, the Causal Pathways How-To chapter offers a step-by-step support on planning a causal pathways evaluation. And finally, on the right, you'll see our commitment to learning and acting together. The Causal Pathways Brain Trust, which I love, is a space where funders can work through really tough real-world questions in collaboration with field experts, because none of us is, doing this work alone. And so you can find everything at causalpathways.org. And if you have questions or want to connect, just reach out to our colleague Carolina here at carolina@causalpathways.org. And we'd love to support your next step. And I'll turn the last words over to Hippolyte. Thank you, everyone.
Hippolyte, you're on mute.
Yeah, thank you so much, Kimberly, for bringing us to the closing point. If you are looking for more resources to help you, the better evaluation resource page is a place to go, where we have a landing page for Causal Pathway Resource Hub. From there, you can explore a growing body of literature on methods, case studies, and guidance, all curated to help you to apply causal pathways evaluation in a real-world setting. Whether you are just starting out or looking out to grow deeper, feel free to go and check out those places. So this is the resource hub. Carolina has put up the web on the chat, and take it and move on. We would like to thank you very much for coming in today to be part of this exciting opportunity. Thank you, Carolina, for being there to help us through the slides. I would like to thank Causal Pathway conveners Julia and Julia and all the participants. Before you go, please take a moment to complete the end of session survey. Your feedback is really important for us, so it will keep us. We appreciate your time and your commitment, and thank you for coming.